Most of us still have fresh memories of the COVID-19. We still even know that COVID-19 vaccination still is going on up to now. And everywhere we hear COVID-19 is still present with us. Now I want you to understand this, that COVID-19 was a virus and is still a viral disease. And viral diseases, we cannot manage them through these drugs. Now, one of the drugs that was used to manage viral condition, that is COVID-19, was hydroxychloroquine. And all of you remember that it was suggested, or it was even used in conjunction with azithromycin to help you manage the virus. However, it did not work. And the reason why it did not work is that drug, number one, it causes immunosuppression. So it suppresses your immunity. And remember, viral conditions rely on how strong your immunity is. That means if a virus gets into your body, it will start multiplying. However, your immunity is the one that will suppress the viral multiplication. And therefore, if you had a strong immunity, you survived it. Now, this is the reason why COVID-19 got away or cleared most people who had diabetes, who had HIV, who were on cancer therapy, or who had cancer. And the reason for that is all those four are the reasons why you have a low immunity. So they cause a reduction in your immunity. And if you reduce your immunity, then of course you give the virus a chance to rejuvenate, basically to just multiply and proliferate. Now we understand that already, and we introduce a drug that is lowering your immunity, hydroxychloroquine. This is an antimalarial drug. It is also a drug that is used in rheumatoid arthritis. So it lowers your immunity. So this drug was introduced and it was used to treat COVID-19. Now, it was then withdrawn because, of course, after questions came in and then they realized there's a problem. So it was withdrawn, and the therapy of hydroxychloroquine in combination with azithromycin, was done away with. So I want to challenge you through this video. Anytime everybody has experienced a viral condition, that has to relate to common colds and all this. Please boost your immunity, and your immunity can never be boosted with drugs. Viral conditions can never be treated with drugs. Viral conditions are suppressed, or their multiplication is suppressed by boosting your immunity. And how do you boost your immunity? Diets, healthy keto diets, zero carbohydrates, because sugars and carbohydrates and those processed foods will cause you a low immunity through insulin resistance. And once it does that, then you'll be vulnerable. Number two, these foods are highly inflammatory. The seed oils, the wheat products, the sugars, the carbonated drinks, all these foods, the processed carbohydrates, these foods are the ones that mess up your gut. And once they mess up your gut, what happens is you will be unable to absorb nutrients in their adequate amounts. Therefore, your immunity will start being altered. Again, that is the beginning of autoimmune conditions, a messed up gut. And also, these foods kill your adrenals or your kidneys. Once they do that, then of course you'll be unable to produce hormones that will help you suppress the overreacting immunity. That's the beginning of rheumatoid arthritis and all autoimmune conditions. So fix your diet, fix your gut through fasting so that you can absorb these nutrients and heal those ulcers and heal those inflammation in your system. Once you do that, and again, remember, fasting is an ultimate immune booster, because autophagy, which is prolonged periodic fasting, autophagy heals inflammation. It cleans up the cells. You need that. Number three, no drugs at all. Drugs called steroids, dexamethasone, prednisolone, those drugs that you use for asthma, for acne, for autoimmune conditions, please, you stay away from them because they suppress your immunity. Okay, so again, if you want to boost your immunity, start fasting, eat healthy keto, go to the gym and work out, reduce the amount of stress in your life so that you reduce the amount of cortisol that will cause you a problem with the immunity.